Hey everybody, Matt Johnston here. We're still talking a little bit about OSHA and preparing for reopening and some of the things that employers need to be worried about as they prepare for reopening at whatever level or phase that they may fall into. So the first thing that I want to remind people of is that employers are required to exercise a general duty to protect their employees from known hazards that can cause death or serious illness. So it's called the OSHA general duty. I have another video on that a few videos ago so that you can take a look at that. Today I want to talk about how we start building out a plan for reopening and the things that you need to be considering when you are putting together an infectious diseases response plan. So the first thing that you need to be cognizant of is what is the level of exposure that your employees are going to be experiencing. So OSHA talks about 4 levels of exposure. The lowest risk is called low exposure risk. And these are employees who would not have contact with people who are known to be or suspected of being exposed to COVID-19 or are sick with COVID-19 or are not going to have very close contact with the general public. So these might be people who are working on an assembly line well apart from people in a manufacturing zone. Those sorts of folks. So folks who have very little contact with the general public. The next level up is medium exposure. Boy, they're so original there at OSHA. So medium exposure are those people who are going to have required frequent or close contact with people who are infected or may be infected with COVID-19 or could be COVID-19 patients. So in the way the OSHA talks about this is that workers in this category may have contact with the general public, but if you are in an area where there's not an ongoing community transmission concern, so if you're in a very small area, very small town with hardly any interaction, you're at the lower end of the medium exposure spectrum. But if you're going to have high density population, schools, things of that nature, that may be a little bit higher, and so you're going to have to take some protective measures. Next up is what is referred to as high exposure. Again, super creative, these folks at OSHA. These are the people that you might expect to consider. So healthcare delivery workers, so doctors, nurses, other hospital staff who might be in patient rooms or outpatient services if they're, for example, a doctor's office. First responders like police officers, firefighters, paramedics, EMTs, things of those folks. And if you happen to be in the mortuary business, mortuary workers. That's what the OSHA considers those high quality categories. There could be some other folks that are in there. Dentists and dental assistants would fall into that situation. So these are folks that are going to be in contact with people who are known or suspected sources of the virus. Finally, there is the very high exposure risk, and these definitely include dentists, doctors, nurses, paramedics, EMTs that are performing things that create or require people to be in close proximity to other people breathing in and out, particularly COVID-19 patients who are breathing in and out. So those folks are going to require some additional procedures, additional protective equipment, and things of that nature. So the first step that people have to do is, if you're an employer, is determine where is your risk level. That risk level is going to determine, among other things, the kind of personal protective equipment that's going to be required, PPE. As a general starting point, you should follow state and local guidelines about being masked, particularly if you are working indoors. So if you're working indoors, it's probably going to be a general idea to have everybody, all your workers, masked in most circumstances, may not always be the case, you are going to have to make some accommodations for your own business and how they operate. So in our next video, we are going to talk specifically about PPE. I just want to let everybody know that PPE is going to be required. Employers are going to have to provide some basic level of PPE for their workers on a regular basis. And what that is going to include is going to depend very much upon the risk level that you are experiencing. In the meantime, stay safe out there and start planning for your reopening. It's coming. Bye-bye.